there are facts about suicide risk that are an important basis for the development of the new guidance. And I'd like to go through these briefly. In the United Kingdom, people who die by suicide, which is sadly approximately 6,000 individuals per year, we know that somewhere between 25 and 30% have been in contact with psychiatric services at the time of death, or have been in the year beforehand. And therefore, it's entirely logical to try to predict those patients most at risk. But the fundamental problem, and indeed the reason really for the development of the guidance, is that suicide risk prediction largely does not work. So let's consider some of the evidence for this in terms of what we know about prediction of suicide. Aspect is of people who died by suicide, how many had indicated that they were thinking about it beforehand. And I'm going to refer here to a report from the National Confidential Inquiry, in which clinicians have recorded their impressions of suicide risk in patients who've subsequently sadly gone on to die by suicide. And based on data collected over a long period, so a very large number of people who sadly die by suicide, the clinicians indicated that it was thought by those caring for the patients that at the last service contact, suicide risk was either low or absent in 85% of cases. So the vast majority, and even in terms of longer term risk, nearly 60% of cases, it was thought that this risk was low or absent. So there's a lot of other evidence, a lot of other studies that have been done internationally that have come up with similar findings.